Well, let's talk health matters now, where at least 10 people have died following an outbreak of 91 suspected cases of diphtheria across 14 local government areas in Jigawa State. Permanent Secretary in the state's Ministry of Health, Salisu Mu'azu, says so far 2 cases have been confirmed at Kazaure and Jahun local government areas, while some samples have been taken to Abuja for confirmation. Dr. Mu'azu pointed out that this outbreak is particularly concerning as it occurred in areas with a history of zero-dose routine immunization against the epidemic. They promptly notified the National Primary Healthcare Development Agency and the National Center for Disease Control to coordinate further actions. Local communities have been advised to remain vigilant and follow directives issued by the health authorities to mitigate the spread of diphtheria. And for more on this, I'm being joined by public health professional, Professor Titus Ibekwe, to give his perspectives on this issue. Good to have you with us on the news at this time, and he joins us from Abuja. So first off, let's briefly understand what diphtheria is and why it is a significant concern in the context of the Jigawa outbreak.
Good evening, Nigerians. It's very unfortunate that we're still talking of re-emerging diseases right now. Well, diphtheria is a bacterial infection which is caused by the bacteria strain Corynebacteria. It is a vaccine-preventable infection which is highly contagious, and basically it affects the airway, the breathing passage, the nose, the throat, and sometimes it can also affect the skin. How does this present? Presents with fever, high-grade fever, just like most infections. And in addition, there is difficulty with breathing and difficulty with swallowing. And this is basically because this bacteria produces a toxin which inhibits the production of protein within the tissues affected. So say is an inhibitor of protein synthesis. And when this happens, the surrounding tissues that is affected is destroyed by the toxin that is elaborated by this bacterial infection. So that during the course of presentation, you look into the throat, you realize that there is a membrane, a whitish tissue that is covering the back of the throat, including the area that we call the tonsils. If you attempt at pulling this pseudomembrane, peeling it off, you will be met with serious bleeding in the process. And this is transmitted through droplets and also close contact. Because of this mode of presentation, some people call this the strangler, because obviously the person that is suffering from this, you will realize that it's almost breathless. So similar to what we see in cases of COVID-19. Some people also call it kiss of death because of how easily transmissible this is. And basically in the environment where this happens is where children and even adults, but it can affect both children and adults, are not vaccinated against diphtheria, or an environment that is filthy. We recall that this will be the second wave this year in Nigeria. The first wave was between January and May this year, before we had the second wave. Kano, Osun, and Yobe were affected initially, and in early 2000, Lagos, Benin, and even Katsina State were affected. Now we're talking of Jigawa with serious deaths, because the complication, the heart can be affected, what we call myocarditis, which is inflammation of the muscles of the heart, and laryngeal spasm. So the airway will close up in the process. And this is really very unfortunate. And we
Indeed.
can say that
Let me quickly come in here, Dr. Titus Ibekwe. You mentioned earlier the case of immunization, if this isn't done early enough. And there is also this concern raised by the State Health Ministry that some areas, some of the affected areas, have a history of zero-dose routine immunization. Now, what do you make of this? And do you think this could possibly be the cause of what we are witnessing in Jigawa State?
Yes, that information is very important because recently Gavi is the body that has been responsible for ensuring that vaccine is readily available and supplied free of charge across board, so that it gets especially to developing countries. So they released an information that over 12 million, children within developing countries of the world have never had a single dose of any of the routine immunization, despite the fact that it's readily available. So that is what is meant by zero, immunization. And that is on its own is a source of concern, because usually hard to reach areas and false information being peddled and spread is what will make parents, to shield their children from receiving the immunization. And this is readily available because it's part of the routine immunization.
Right.
And beyond that, there's also need to do an evaluation and find out the level of immunity that people around within the country, Nigeria, have presently, so that we may consider a booster dose if necessary.
All right, and that's a fine place to leave it. Dr. Titus Ibekwe, medical health professional, we appreciate your insights on the news at 10 tonight.
Thank you for having me.